There's wild zoo animals. A bear. It was just really painful. I think that was the thing I remember most. It was pretty much the worst pain I've experienced, I would say.
Paul Dowden was in his 40s when he was hit by shingles for the first time. It's a debilitating disease caused by the same virus that brings on chickenpox. Triggers include age and stress, but it can happen to anyone, and it can have lifelong effects.
Let's go outside.
Paul's gone through it 3 times.
I also have 3 children. I have 1 child with significant disability on cue, and he needs 24-hour care, and he's 30 kilos, so you need to be able to lift him because he can't walk. And when I had shingles just over Easter, I was hopeless. I just couldn't help.
The last time he had it, he was fully vaccinated. An expensive ordeal, but one he says was worth it. The vaccine itself, Shingrix, helps keep the infection at bay and is highly effective.
We've now realised just recently that the vaccine can recruit new T cells into our cell-mediated immune pool to control and resist the occurrence of shingles.
It's also in high demand.
Demand has been huge, to be honest. Every pharmacy across the territory is receiving calls and inquiries all the time as to the availability of Shingrix.
Part of the National Immunisation Program, Shingrix is free for people aged 65 and over, First Nations people over 50, and adults with severely weakened immune systems. The program costs around $827 million, and it's estimated around 5 million people are eligible. ACT Health is responsible for the storage and distribution of the vaccines, but it has no control over how many doses it gets.
Demand has been really high in the ACT. We've had really good uptake, which is great. And so that may have led to people thinking that there's a supply issue.
But there's no supply issue, is what you're saying?
We receive our supply from the Commonwealth Government, so they are responsible for procuring vaccine.
But it can be a challenge even if you're willing to pay around $300 a dose. Colette Gilmore paid for the first shot. She was told to come back for the second in 3 to 6 months.
Went to get my vaccine and there was no stock. And that was in November last year.
November last year,
Yeah.
And you still haven't had your second dose?
No, I haven't, no, and I have been back.
The Pharmacy Guild says there is availability for those who wish to pay, but each pharmacy only receives 10 free doses per month. It says the ACT is receiving its fair share based on population, but that doesn't factor in Canberrans' attitude to vaccination.
We know that Canberra has the highest vaccination rates across Australia, and we're an informed society generally.
The ACT is in a unique position. We have very well-educated population and demand for vaccines is always high.
In a statement, the Department of Health said more than 1.1 million doses have been administered since the program started last November. It said demand has exceeded initial forecasts and that discussions are underway with the supplier to bring in additional stock. Isaac Naruzi, ABC News, Canberra.